We established with others, but in France and as part of the IFM group, we established some years ago melphalan, prednisone, thalidomide as a standard of care for myeloma patients. So we did that 5 to 10 years ago, and based on an IFM study, this regimen was approved in the EU. So after that, we took this very strong control arm and we investigated the efficacy and the safety of lenalidomide in combination with low-dose dexamethasone. And basically, 1,623 patients. So that's the largest study ever done for registration in myeloma. So the study, we have approximately 1,000 patients receiving lenalidomide and low-dose dex in that study. And basically, we were able to show that lenalidomide and low-dose dex is a better regimen than MPT for PFS, for all other secondary endpoints you can have in this kind of study, for overall survival as well. And in terms of safety, in fact, the safety profile of this regimen is basically good. So it's totally in line with what we know from the safety profile of lenalidomide and dex, because this combination is used in relapsed myeloma. So this is a very manageable regimen. The good news is also that the incidence of second primary malignancy, especially hematological SPM, was extremely low with lenalidomide and low-dose dex. And as you know, we got some SPM in the past in some lenalidomide studies. So the regimen is manageable, the regimen is safe, and the regimen is associated with better efficacy results. As an hematologist, I would say that it has to be a new standard of care for transplant ineligible patients. But as you know, the registration decision is the decision of colleagues in regulatory agencies. But as an hematologist, I would say that it is a new standard of care for myeloma patients.